Do you know that 80% of women will develop uterine fibroids by the age of 50? Yet many women don't know that they have them. Hi, I'm Dr. Stelina Gowdy at Gowdy Family Care Center, and this month we're raising awareness about fibroids, what they are, the symptoms to watch out for, and when it's time to talk to your doctor. Fibroids are non-cancerous growths that develop in or on the uterus. They're made of muscle and fibrous tissue, and they can range in size from as small as a seed to as large as a grapefruit. Now, we classify fibroids in three different ways: either intramural, which is within the muscle wall of the uterus, or submucosal, which those are just under the lining of the uterine cavity, or subserosal, and those are on the outer surface of the uterus. They're extremely common, and they're more likely to develop in women in their 30s or 40s, and Black women are more likely to have a higher risk or often more severe symptoms with them. Now, many fibroids cause no symptoms at all, but when they do, here are some of the things I'd like for you to watch out for. Either heavy or prolonged menstrual bleeding, periods that are lasting more than a week, if you're having pelvic pressure or pain, frequent urination, or if you're feeling like you're having difficulty emptying out your bladder. Sometimes you could have backaches or leg pain related to fibroids, or pain during intercourse. For some women, fibroids can also contribute to anemia, and it's due to the heavy blood loss, or it can complicate pregnancy and fertility. If any of these symptoms sound familiar, it's worth having a conversation with your provider. Now, the good news is fibroids are very manageable once they're identified. Here's what the process would look like. Now, first, of course, we have to have a diagnosis. Now, that would include a pelvic exam, followed by some imaging like an ultrasound or sometimes even an MRI to help with confirming the size and the location. Now, the treatment is going to depend on the symptoms you're experiencing, the size of the fibroid, and the location of the fibroids, and whether you're hoping to have children in the future. That treatment can range from either watchful waiting, and that would be if you're having no symptoms due to those fibroids. Sometimes medications, and that would be to manage the heavy bleeding or the pain. Minimally invasive procedures like uterine fibroid embolization, that would entail essentially decreasing the blood flow to the fibroid, which will help with shrinking the fibroid. Or surgical option like a myomectomy, which would be removing the fibroid itself, or in some cases a hysterectomy, which would be removing the uterus altogether. Now, there is no one size fits all approach. Treatment should be individualized based on your history, and it should be tailored to you. Now, fibroids are common, but you don't have to live with the symptoms. If heavy periods, pelvic pain, or pressure is affecting your daily life, don't wait. Bring it up. If this video was helpful, please like, subscribe, or share it with someone who needs to hear it. And if you'd like to schedule an appointment with us, visit us at gowdyfamilycare.com or give us a call at 706-410-2684. Take care of yourself, and I'll see you on the next one.